Welcome to the lighter side of the spectrum, the podcast that celebrates the multiple hats we wear and the juggling acts we perform in life. Whether you're parenting kids and teens on the autism spectrum, navigating the ever-evolving healthcare industry, or building a more inclusive and impactful world, this is your space to find connection, inspiration, and growth. Together, we'll share stories, tackle challenges, and explore how innovation and inclusion create better outcomes for everyone. Because no matter the spectrum, there's always a lighter side. Now here's your host, David Kaufer.
Hello again, everybody, and welcome back to the lighter side of the spectrum. Today, we have a really special guest. I can't wait to dive into it. Our guest today is Dr. Barry Prizant, who's one of the most respected and influential voices in the autism world. Barry is a speech-language pathologist, researcher, consultant, and the author of Uniquely Human, A Different Way of Seeing Autism, a hugely influential and award-winning book that helps shift the conversation from deficits to and pathology to humanity, understanding, and connection. For decades, Barry has challenged the old models that asked, what's wrong with this person? And instead encouraged us to ask, what is this person experiencing and how can we best support them? That shift has had a profound impact on parents, professionals, autistic people, and families around the world. And what makes Barry's work especially meaningful is that he has never reduced autism to just a checklist of symptoms. He has always centered dignity, emotional safety, relationships, and the belief that every person deserves to be seen as fully human. In a time when so many conversations around autism are still shaped by fear, control, and skepticism, Barry's voice continues to offer something different and very much needed today: wisdom, compassion, and a deep respect for autistic lives. So today we're going to talk about community, neurodiversity, the power of presuming competence, and how the autism conversation has evolved since Uniquely Human was first published. And we'll also talk about what still needs to change, especially for non-speaking autistic people and others whose humanity is too often questioned or misunderstood. Barry, with all that being said, welcome to the lighter side of the spectrum.
It's a pleasure to be with you, David, and I'm really looking forward to our conversation.
Yeah, we have a lot to talk about. But let's, start at the beginning, because one of the things I'm always interested in, I think is fascinating, and you're no exception, when having read your book, is talk about going back, because you've been at this for a while, right? Your journey began a long time ago in literally kind of a different world, both in terms of how the autistic neurodiverse community, which they weren't even called that back then, was seeing how educators worked with them. But can you tell us a little bit, because I thought it was a really great story, again, kind of like what got you into this field in the first place, going back to the beginning?
What got me into the field actually was my girlfriend in the first year of college. I was working in this job. My father got me in Manhattan. It was kind of like a sweatshop job. And my girlfriend was working upstate New York at a summer camp, a residential summer camp for people with a variety of labeled disabilities, children and adults. And we missed each other, and a counselor was fired, and she called me, and I went up to the camp, and all of a sudden found myself in the lived experience and the responsibility to make sure the people I was with were happy, having a good time, were safe, and it ended up being an incredible launch and learning experience for me.
That's incredible. Just right, just how fortuitous, right? Just again, that fateful, just that one counselor being fired and what it opened up for
Yes.
you and kind of led you on the way. And you had no experience really before that, right? In terms of working with other kids or anything like this was like really kind of all new for you.
Yeah, no experience directly, but I do remember, I've had the chance to reflect a lot going back way before that. Like in elementary school, when kids with disabilities were being bullied, it really upset me.
Right.
And I remember I did volunteer in a classroom in sixth grade. There was a separate classroom down the hallway. This was a public school in Brooklyn. And I volunteered to go in there and do art and other things with the kids. And shortly after that, and there's a long story, but I'll make it very, very short. My mother passed away unexpectedly.
Mm,
And on
I'm sorry.
reflection, I felt, I realized what it felt like to be othered. I didn't realize it at the time, but I was the only kid I knew who did not have a mother. And as I reflect back, I realize I always saw myself as different from the other kids. It was very tragic and sudden, and I probably went through PTSD for a number of years, as my father did. But the point is now, years, decades later, I reflect back and thought that that was some of the early seeds of looking at people who felt different, who were marginalized, who were misunderstood. Because on some level, and I grew up privileged, middle class,
Hmm.
white
Yeah.
kid. But on another level, I did feel different than other kids.
Yeah. That makes a lot of sense. I mean, so it sounds like the empathy was there, right?
Yes.
I mean, in terms of, that was kind of part of you, but then you kind of layer in, like you said, the grief, the feeling different. It's kind of a different level of empathy, I think, then that you're probably able to connect with those who, like you said, you just kind of saw how they were treated or how they may feel, and you just treat them like a human, right? Like it sounds so simple, but
And I do think a lot of people go into the field, whether it's speech language pathologists, special educators, psychologists. If it isn't a direct family connection, I think other people go into it because they also have felt something in their own lives that they could connect to see how many of our wonderful kids and adults are treated by others who don't understand them.
I mean, you've had a long, distinguished career, on the academic and practicing side. Can you touch on that too? Because I think that's just so important. It's interesting, but also important, right? Because it gives you these different lenses. I mean, you've been a researcher, as I mentioned, but you've also, gotten your hands dirty, so to speak. You've worked with, probably literally thousands of students and patients over the years. So you have, I think, a very unique and important perspective here.
Yeah, and I feel, in a sense, very privileged to have all those opportunities to learn. I was a failed German major. I love languages, and
Yeah.
because of that, and I had taken a number of languages at that point, I shifted to what was then called, and I think it's still an active field, psycholinguistics. So my
Oh,
undergraduate major really focused on the relationship between thought and communication and language. And I was in a school that didn't have special ed, didn't have speech path, in State University of New York Center. I was taking courses like psychological, biological basis of language, which began to touch on autism. And at that time, I was already working in summer camps. So I connected all of this and then went on for degrees in speech language pathology and a doctorate in communication disorders. But I always remained active as a consultant. All the universities I worked in, I was in the medical school at Brown for many,
hmm.
many years,
Yeah.
and worked in a children's psychiatric hospital, but I always consulted. I always went out to public schools. I always worked with families. And that's continued to this day. So I had the wonderful experience of learning really from some of the most brilliant minds in psychiatry and speech and language pathology. Yet I also had the in the trenches experiences simultaneously. And what that led me to, and again, very long story, I'll make it very short,
No, this is great.
is what I was experiencing directly with the kids and the people I was working with was such a clash with what I was beginning to read in the autism literature starting in the very late 60s. I did go to Woodstock, and it was around that time.
Very cool. That's great.
And it just was such a clash, especially early traditional ABA work. So
Hmm.
I was reading, Lovas, the grandfather of ABA, saying that echolalia or repeating speech was something that was pathology and it was meaningless parroting and it was psychotic speech and it needed to be extinguished. And I was
Oh
not
my God.
experiencing that at the time. I was working at Buffalo Children's Hospital with a whole bunch of preschool autistic kids, and most of whom were echolalic. And I'm
Yeah.
saying, wait a second, this is something different here. These kids are learning to communicate. It serves a wide variety of functions. I asked the parents, and we're going back way back, early 70s, and the
Yeah.
parents gave all kinds of explanations, which kind of coincided with my observations. And I got a grant for my doctorate from the department at that time it was called the Bureau of Education for the Handicapped, for
Mm.
full funding of a video taped study following 4 kids over a year. And what I found and was able to document was basically what led to depathologizing echolalia. That, wait a second, not only does it serve different purposes, this is how kids request, this is how kids keep things in memory, what we call rehearsal, many different functions, all
Wow.
peer-reviewed,
Yeah.
published stuff now. Um, but the bottom line was that I always had that experience of feet on the ground in the trenches to look at the technical so-called scholarly literature and say, no, I don't think that's right. No, that's going up, down the wrong rabbit hole here. And my whole career has been pretty much about that, with wonderful colleagues and mentors that I've had over the years. And I'll kind of finish up that little piece by saying one of the most gratifying things in my career is things that we wrote about, published long before Temple Grandin stepped up, you
Right.
know, long
Yeah.
before there was an autistic voice, is now totally validated by what autistic people are saying about their experience. And that's been one of the reactions, to my book, where the first edition came out in 2015, my mainstream book, Uniquely Human, where so many autistic people say, thank you, Barry, you got it right. Hey, were you autistic in a previous life? And I was making,
That
as
that's
we
a
all were,
compliment, right?
we were making educated guesses in a sense, trying to
Hmm.
understand the experience. But the benefit I had was I was trained in child and human development. And so much of what I was learning from my autistic clients, kids, and families came out of a perspective that each human being is unique. This kind of gets to the neurodiversity piece. We all have different brains. We all are good at some things and not so good at other things. And that was always the lens that I had in my work.
Well, that's what I love about your perspective and what comes through in the book, Barry, is and if you kind of look at your career as you're talking about it, it's been a very organic approach, right? It's not a pre-calculated, like I'm just, I'm going to rise to the top of this field and I'm just, like it's really been, hey, I'm going to learn, I'm going to observe, I'm going to offer my thoughts and the questions. I mean, there's a lot of that in the book that I love that you talk about where again, parents or teachers have questions about a certain student and so you observe and you just ask questions, instead of coming in, which again, I think is unique in this field. I think there are a lot of people who come in, I'm the expert.
Yes.
This is what's happening. Like you said, pathologizing. I mean, you still see that unfortunately today. I mean, that was how many years ago? That's still the root. You still hear that as being a goal sometimes, like in ABA, those who are still, utilizing it, unfortunately.
Yeah. And let me throw a little bit of additional spice into the mix.
Good. I love
Of,
spice.
I was a street kid in Brooklyn. I was a schoolyard kid, you know? And so it's kind of like if you see something that you don't like, you don't run the other way, you push back.
Hmm.
And so, yes, I was asking questions, but I was also challenging what I thought were misinterpretations, unfair
Yeah.
assumptions, and misunderstandings. So that pushback piece is something to this day, as you know, and you're doing it in a beautiful way. It's become, and a few years ago we didn't use this term so much in autism, but it's become a social justice issue.
Yeah.
What's going on with people who are misunderstood, who are being marginalized, and how does that affect their quality of life every day?
That's a great point. And you're right. I mean, I think that is an area, like you said, you and I both share. That pushback, that fight for justice. If you see something that's wrong, you have to call it out. Like, how could you not try to do something or say something to help these people? These are humans who deserve everything all of us deserve: dignity, opportunity, respect, which sadly is still lacking in too many areas. And I think that's the fight that you and I really coalesce behind.
And especially when the misinformation is coming from people who, in some cases, are armchair ivory tower academics. In other cases, even if they have clinical experience, it's primarily in a context stripped setting. It's not in the real world. And, it's at the beginning, we were talking about, well, what kind of tips do you give? Let me throw out
Yeah,
a tip
right.
here. What came to mind right away, and it's actually a chapter in Uniquely Able with this title, and the tip is listen.
Yeah, yeah.
Listen to autistic people, neurodivergent people, listen to their families and listen deeply because we're always learning, always learning. And I continue to say my summer camp experiences for 6 years at the beginning of my career, our parent retreat, which we're doing our 28th year of our parent retreat weekend in a few months. That's
Which
where the
which sounds
learning happens.
awesome, by the way. I mean, I know you talk about it on your podcast, right? And that sounds amazing, and then I would love to participate in some point because I just even though our son is 20, I don't think they're ever too old to participate and learn in something like that.
That's actually, part of the magic that we have parents of newly diagnosed preschoolers and we have parents of young adults, not in, some not so, some approaching 40, 30
Yeah.
years of age.
Oh, that's
And
great.
and it's the journey. And so the parents learn from other parents who've been on the journey, and I sit back and have the privilege of listening and learning. So
So you talked about it's been 10 years, just over 10 years, since you published Uniquely Human. Was that part of your motivation there too, in terms of writing it, was pushing back against a lot of the literature, a lot of the stories that were out there?
in a sense, because all of my publications, including clinical manuals and other edited books, I've published 5 books, over 150 articles and chapters. Um, and I knew a lot of that wasn't accessible to the mainstream public. And I
Right,
loved, and during my presentations, I would always tell stories. And the truth of the matter is that my son and my wife over the years said, you need to put these stories into a book that anybody could read. It doesn't have to be an article that was published in the Journal of Autism or Neurology or whatever. And that was the motivation. And so Uniquely Human came out first in 2015, and it's a storybook. Uh,
it is. Yeah.
and my co-author is the son of an adult young man on the spectrum, Tom Fields Meyer. He's a professional writer, so he really helped tell the stories in a way that people can grasp and embrace. But all the stories are from my clinical and everyday in the world experience. I like to refer to that as my lived experience in the world of
Right.
autism. Because some people have said, and this is kind of the nature of the field of autism, there's a lot of opinions, and some people have said, how dare you write a book about the experience of people with autism? You're not autistic. And I said,
Right.
I'm writing about my lived experience and what I've learned. I'm not claiming it is a valid depiction of what every autistic person experiences. Now, thank goodness, apparently, so much of it does resonate with autistic people that some of the best supporters of the book have been autistic people.
I could see that too. And I think you make it pretty clear, again, just the way the book's written, that you're not trying to speak for the autistic community. Again, you're speaking from your experience and your stories. There was one reference you made in the book where you're talking about how difficult it can be for some autistic children to learn social skills. And you use the analogy of the cafeteria, like you go into a cafeteria for
Yes.
most of us, right? And you kind of scan the room, you try to read the room, right? You read the room, which I thought was a really great analogy. And some autistic people just don't have that ability to read the room. Like they're good for whatever reason, right? They could be wrapped up in their own world and they just maybe lack that. But I thought was what I made me think about also, Barry. is the non-speaking community.
Yes.
They can read the room, right? Like, and this is one of these important messages that comes out in terms of like the naysayers when a lot of the non-speakers are able to communicate. They're always like, well, how can they know this? How can they know how to communicate? How can they know how to talk about these subjects? They've been reading the room their whole lives,
That's
right?
right. Right. It's really true. I mean, I think what so many of the naysayers say is, well, this person, is can't speak, doesn't look that like they're as socially aware as another person of the same age. Therefore, they need to be taught, and actually this goes back to very traditional ABA. They need to be taught every absolute skill and learning, and they need to be trained to do
Hmm.
that, as opposed to they can't learn just being immersed in experiences and being guided with support for those people who need that level of support, but that they're taking in a lot and they're putting together their own kind of sense of how does a cafeteria work. Um, and I think that's, observational learning is very powerful in all human beings. And I think that's been dismissed for decades in people
Yeah,
who don't.
absolutely. Absolutely. And it's so again, it's so systemic, I think. We talked about having our segments, and I wasn't sure if I'd do a parent confession. I'm gonna do my parent confession now. So producer Dave, let's cue up that jingle.
Morning routines can go astray. Found socks in the fridge one day. Laughter's the best remedy. Hey, we're just finding our own way. Mom, dad, confessions every week. Sharing joys and moments we seek. Honest tales that make us unique. Join the club, we're never meek.
So this is the segment, as I told you, Barry, again, kind of the human side, right? Where I or parents or my guests, we look back at something that makes us cringe or we regret. And the timing's perfect here because we're talking about with non-speakers, and of course my son's Stone, who listeners are familiar with. Um, he began school, one-on-one school. It's a long story, but basically we had to sue our school district to get access to communication for him. And we were able to do that. And I accompany him. And this began early on, about almost 3 years ago. We started this as his communication regulation partner, right? So this is a whole new journey. So we're sitting there in class, one on one. And again, I'm saying this because I'm coming from the traditional school background, right? Like you have to sit in class, pay attention, look at what the teacher's telling you. If they're showing a video, watch it. Well, those early days, Barry, I would be there because Stone would be doing his thing that non-speaking autistics do, looking away, just, stimming. I'd be like, hey, hey, pay attention, right? And then finally he's like, dude, I'm paying attention. Like I can do this. And, his scores on his quizzes and his academic, I mean, it reflected, like it was obvious. I was the one just being a dummy, trying to treat him like a traditional student because that was my model, right? Like I'm just saying, oh, this is what you need to do, which is just dumb, right? Looking back.
Yes. Yeah. Well, I have a true confession here
Oh, let's
also.
hear it. Yeah.
Yeah, and it's not so distant from the example you just gave with Stone. Um, we for a number of years, and we're hoping to start it up again, replicating the Miracle Project program out of Los Angeles, at Brown University. And that is a theater and performing arts and musical program. It's
Oh,
award
cool.
winning. Just a little bit of a plug for my dear, dear friend, Elaine Hall, who's a mom of a non-speaking son. And one of my colleagues at Brown had a grandson on the spectrum. And I was so motivated to get him involved in the Miracle Project program. And we started every session sitting in a circle and kind of singing a song just to get everybody grounded and to put
Yeah.
a positive emotional tone into the beginning of the day. And he's a very, very active little guy. And at the time, I think he was 6. and everything was new to him. But I was saying to his grandmother, "Oh, he's gonna love it. Oh, let's get him engaged." And so I sat down on the floor with him about 10 years ago, and he was scrambling and saying, "I'm not so comfortable here. I'm not so sure about what's going on." And I held him. Um, I guess
Mm-hmm.
I guess people would say restrain. I mean, he wasn't having a
Right.
meltdown, but he was giving clear
Right.
signals he didn't want to be there. And I look back on that and saying, "Oh my goodness, he needed time to settle in on his own terms, maybe
Right.
sit at a distance, even walk around outside of the circle to observe what was going on, so he could get a sense of this is fun. I could be safe here, and so forth." We've all done that. And sometimes we've done that where it has, resulted in interfering with a relationship with a person that was supposed to be supporting. But that came to mind right away when you were talking about Stone. Yeah.
Yeah, it's interesting, right? It's just it's so instinctive, I think, for us in certain situations. And again, we've been kind of trained and conditioned our whole lives in different ways too. And a lot of I've learned so much of this journey is trying to unlearn that.
Yes. Yeah. One of the things you had mentioned that we could talk about is, well, what needs to happen for us
Yes.
to move ahead.
Yeah.
And unlearning is a big, big issue. Uh, and we have this history of autism, quote unquote, treatment in this country. So much of it needs to be unlearned. And even some of it clearly, thank goodness, has been unlearned, like parents cause autism. It's like,
Oh
uh,
yeah.
a parenting.
The refrigerator mom, syndrome.
Exactly.
Right. Yeah.
But there's still so much. And it's interesting when you look at the field of applied behavior analysis, they're actively trying to unlearn so much of what was the heart of ABA a few decades ago and still is for some people. And that is the compliance training. Okay. That
Compliance
is the
training. Yeah.
extinguishing the behaviors that you see as undesirable before even knowing, what purpose it might serve for a person. And on and on and on. And they're adopting terms that we've been using for almost half a century. And that is trust, relationship based, respect for the person you're with. And they're using those terms now in a way saying, we need to unlearn what we were doing because we could see this is now the way the field is moving. But unfortunately, so many of these people don't have the training in doing that. So they use the terms. There's a difference between lip service and really having a deep understanding of what that means.
Can you talk a little bit? We haven't really talked a lot about this, but you can speak to it, from your experience, just with when it comes to ABA for listeners who aren't familiar with or they've heard of it, they've been thinking about it for the kids. Can you talk about like what kind of experience does it take to be an ABA practitioner? Kind of how does it work? And you know, some of the potential issues that could raise.
Yeah, it basically, some people say ABA really isn't a treatment approach. It's a kind of science-based theory of how you learn. A lot of it is based upon the work of Skinner, but there are many other very well-known historical um, behaviorists, and which really took roots in this country in the 50s especially. Whereas a lot of the deeper thinkers in my mind who look deeply into how people think, how people develop, the relationship basis of that, a lot of those came from Russia and Europe. Okay.
Oh,
Like
no kidding. Wow.
Piaget, Vygotsky. Oh, absolutely. No doubt about it.
Okay,
Uh,
that's
uh,
interesting.
oh, yeah. And even how you learn language, there were all these debates of Chomsky versus Skinner, where Chomsky said language has to do with how we organize information and put that into grammar and words. Whereas Skinner was saying, well, basically, you learn language like you teach a pigeon to peck to get, pigeon food. Uh,
Right.
and there are approaches now called verbal behavior approaches where it's based upon the work of Skinner, who never worked with autistic kids, who developed this theory of how people learn, which has been debunked, especially in terms of language and communication. I mean, Skinner basically said in his retirement speech to the American Psychological Association, he basically said, You are ruining the science of psychology by trying to think about how people feel, how people think. That is not science. The only thing you could look at is how people behave. And so ABA became, how do we increase desirable behaviors and get rid of undesirable behaviors without going much, much more deeply into that.
Into
Why
the
is this,
whys. The
why
why
is
is
this
this
kid having a
happening?
meltdown?
Yeah.
And actually, that's a big theme of Uniquely Human, what we call the
Yeah, I was
deep
just going
why.
to say that's that. I mean, in a lot of ways, I think Barry, that is the theme that you get across is the why.
The deep why. And I learned that from a woman on the spectrum from England, Roz Blackburn, who, she basically said, the people who support me the best are the ones who ask why when I'm getting highly anxious, if I'm about to have a panic attack. And again, she is one of the earlier appearing autistic people who could explain what was helpful for her, what was not helpful for her. And it was about asking why. And I brought Roz over to the US a few times. We presented together. I give her full credit for me learning. In a sense, in my training, I always ask the why. But to hear it from an autistic person, for me, that's golden. It's kind of, and it pertains to everybody. It pertains to all human beings. Um, so, and so this gets to the whole issue, which I think is important for us to touch upon, and that's the sense of community.
Yeah,
So when
yeah. I
we
was
talk,
just going to go.
so when we talk about ABA, we're talking about a community of professionals and practitioners who believe that all learning happens by reinforcing behavior. Okay? By reinforcing behavior, you target and you want to build or you want to change. Okay?
Yeah,
And sometimes that happens without putting any attention into trying to understand that person's perspective. How do they feel? If they're looking anxious or they're running away, that's non-compliant behavior.
that's non-compliant. Yeah,
And if there's still approaches in ABA right now where the first steps are trained compliance.
and that is so dangerous. I mean, it's really dangerous because you're dealing with this population that's already vulnerable, right? For so many different ways, particularly the non-speaking. And now you layer on this level of compliance, this expectation of compliance to anyone who's in a position of authority.
Yep.
I mean, they're even more vulnerable, right? And they don't have the ability to push back. They're, they're almost punished for saying no, right? Like you said, they're saying non-compliant. They can't even, like in these therapy sessions, they can't say no.
Yeah.
You're taking away, strips away. This is what I see in hindsight. And again, if we want to do parent confession round two, it's going through ABA, and we didn't know what we didn't know. But again, looking back in the experience, and of course talking with Stone about that, it mortifies me, right? Like again, that it kind of strips away a lot of that what what little autonomy, unfortunately, some of these individuals have. A lot of it then gets stripped away, and then what? Then they're just like they wander around listening or looking for direction. What do I do? What do like I can't initiate this because I might get in trouble. I can't initiate this because that I'm going to be called non-compliant, right? So what does that do to them?
Well, sometimes I say this tongue in cheek, but it's not so funny. And that is, you see kids going through compliance oriented programs when they're young, and then all of a sudden they're not in a 5 or 7 or 8 year old body anymore, and they're becoming teenagers and young adults. Okay, it's time to work on self-determination.
Right?
You know?
Exactly. Yeah.
And it's like you stripped any sense of
They're like,
personhood and selfhood. If and why is he so prompt dependent? We have to break that prompt dependence. Well, why don't
he
you
had
look back?
years of it.
Exactly. Now, again, I want to acknowledge that even within applied behavior analysis, there's been pushback against that by saying, oh, well, we don't do that anymore. No, that was bad practice. Wait a second, that was the foundation of the field for decades,
Yeah.
you know? And that's the unlearning that has to happen. But I think unlearning happens better when you're in a community of shared values, of shared visions. I think it's very difficult for a single parent, for example, to say, well, maybe I've been wrong, and I need to say to the current service providers, I don't agree with you. You know, my my son or daughter's not reacting well to what you're doing at all. And I still hear that. I still hear from around the world. I hear from parents who saying, well, we went the ABA way, and now I'm really seeing the downside of that. But I don't feel comfortable saying that because these are the people who are providing the services.
Hmm.
So there's that stuck between a rock and a hard place issue. How dare you kind of challenge the people who are available to you to help out? And one other thing I need to say again, we're not going to do a deep dive into this,
Right.
is the misinformation and the propaganda that was put out for years about ABA is the only thing that works. It's the
It
only
was
thing
only
that's
right.
effective.
Absolutely.
And
That's
that led.
huge, though. I'm glad you said that, Barry, because that's huge. I think that had a tremendous impact on parents everywhere and insurance companies for that matter.
Oh, totally. I'm a classic example of being the loudest voice in the room. Um, and the many of us who are relationship and developmentally based, even though we were publishing data that showed other approaches worked, we didn't challenge, whereas they literally, and I could tell you tons of stories about busting into committees and saying, "Oh no, it's ABA." I mean, it became almost cultish. Um, Personally, I was attacked over the years. You're ruining the life of every kid of autism in New England by your search model and by this and that.
Wow.
Uh,
Yeah.
and even up now, the whole non-speakers thing, I'm being personally attacked for exploiting the lives of autistic people for personal gain. Um, Dr. James Todd, a
Yeah.
Skinnerian behavioral psychologist, said that about me in a tweet, which
And that was only in response to you, like you were in a picture, right? Like where you just happened to you were visit. Is that when you visited the tribe and you're like, "Whoa, this was a great visit," and like like
I
as
was
innocent
invited.
as it comes.
I was invited by the University of Virginia to give a talk for the psychology department, and as part of that visit, I was asked if I would meet some non-speaking autistic people who were learning to use spelling to communicate. So it was a few photos that the University of Virginia put online. Say, "Oh, we welcome Dr. Barry
Mm,
Prizant," and I'm literally reaching out to shake the hands of a young man with autism,
yeah.
and
How dare you?
James Todd, the damn coward, posts on tweet, I'm exploiting the lives of autistic people for personal gain. I challenged him by going to his department chair and the university president of Eastern
Awesome.
Michigan University. The tweet was gone the next morning, but I have screenshots of it. So it's like,
It was out there.
oh yeah. And so this attack mode, we are not part of a community that attacks. We are part of a community,
No,
whether it
we
has to
lit.
do with non-speakers or just supporting autistic people and supporting their dignity and supporting their voices. We are part of communities that lift people up. Okay. We are not part of communities that tear people down, put out misinformation, and presume incompetence.
Right. Now, what we are doing, though, Barry, again, you and I and others, which has been needed, is going back to the theme of pushing back, right? We're pushing back because there has been so much coordinated misinformation over the years, coordinated attacks. You had mentioned, Todd with a tweet. There's a website out there, which again, you talk about being a coward. It's published it's anonymous, like there aren't names associated with it. But with this website, they use that to attack non-speakers, and they like to selectively edit videos of non-speakers spelling, talking, typing to try to prove, try to debunk it, to show that it's being. And they actually did that, 3 years ago. I'll just tell a quick story. Again, after, Stone had been spelling for a while, we're all in, right? The world has changed. His life has changed. The movie Spellers had come out, and we were hosting a screening here in our hometown in Washington State. And this is also right when we were suing the school district. We are on the cusp of suing the school district because they weren't accommodating him. So I used my PR background and got a story. I reached out to a local TV station, the NBC affiliate. They came out, did a great story. Reporter, of course, was just blown away by Stone. And I think it was, isn't it Beals who does those, the takedown videos or whatever?
Yeah, yeah, yeah. Beals has undiagnosed, clinically diagnosed people on my
Right.
podcast. Yeah.
Yeah. Anyway, I just happened to randomly find this video, this edited video of the story that the reporter did. It's kind of like what the reporter failed to ask, questions they failed to ask, right? It's just this whole terrible thing as far as like again trying to debunk it. But what really pissed me off is that she edited the video in a totally unethical way, like just lied, said, "Oh, the father said that he wrote this poem, but if you look at the son's spelling, there's nothing, it doesn't match the poem that he said he wrote." I didn't say he wrote it when the reporter was sitting there, right? Like, I mean, this is, like, talking about misrepresenting information and all of that. This is what I'm pushing back. I mean, this is what we're calling out.
Absolutely. And the tide is turning. I mean, it's, when you talk about a few people, and again, it's not worth getting into what are the motivations of people
Right.
who push back and put out misinformation. I think it's different for each one of the small group of
Yep.
naysayers who present on this and publish on this. But I just really think that there are so many people now who understand what a neurodiversity lens offers to us,
Yes.
and the
Yeah.
whole movement. That and a presumed competence. And again, that's even been bastardized. They naysayers say, oh, presumed competence is, oh, this person is a brilliant person. Well, some people are brilliant people, yes, who don't speak. But
Yeah.
it basically means every person is capable of learning. There's a wonderful quote from Ross Green, and he's really known in the field of emotional behavioral disorders, but this kind of crosses over in spectrum. And he has a foundation called Lives in the Balance, a social justice foundation, mostly for school age kids who have difficulties, dealing with school and in their lives. And, what he says, very famous quote, is that kids, and I'll add adults, will do well if they can. And that
Right.
means we have to set the right conditions for people to do well. And part of that is presuming competence, you know? And part of that is providing systems of communication that a person can access. And that's non-speakers are demonstrating that.
Barry, you just had a perfect segue for our autism fact or fiction segment that I just thought of.
Get QuickTime ready, and here we go. This is Autism Fact or Fiction. We're breaking down what's real, what's rumor, and what might surprise you. Let's go.
Okay, so you just made me think of one as you're talking about this because I think it's relevant. So I would say, is this fact or fiction, Barry, that an autistic person, or I guess you could say 80%, but autistic person refuses to use their words if they're capable of talking?
The drive to want to communicate is a human drive.
Right.
Okay. And I think we all, there's a quote, and it actually came from a person named John Woods, who's an expert in communication. And the quote is, one cannot not communicate. But what we're talking about here, especially with people who have neuromotor issues that prevents the development of speech that's intelligible, that what we're talking about here is people who need extra support in finding, if you will, the most accessible way for
Yes.
them to express their
Right.
thoughts and intentions. Now, granted, I always have to acknowledge where there are exceptions. There is something that's called elective or selective
Hmm.
mutism.
Right.
Okay.
Yep.
And,
That's why I
and
wanted to bring this up. Yeah.
and that's not a communication issue. I mean,
Right.
I'm a speech language pathologist. It is related to a condition of high anxiety,
Mm.
where in some settings, even if you can speak, you don't speak because of the dysregulation and the anxiety you're feeling. But that's not what we're talking about for the most part, unless you're talking about the message passing test, where
Right.
where there are some non-speakers who will refuse to engage in doing that because it's either highly anxiety provoking, or you tell the story of Stone
Right.
did not want to pass that because he didn't want to be in that school.
He had he had different motivation. Like he did, yeah, passing would have meant staying in a situation that was not good for him. And he recognized that and smartly, he strategized a way out of it.
Yeah. And I mean, even for, and I've, consulted over the years to a number of autistic kids who were speaking and fluently speaking in some settings, but choosing not to speak in other settings. And you could really put together what were the factors that led to that, and then change those settings where the child feels anxious enough or it's not familiar enough. And, over the course of time, all of a sudden, and I give an example of this of a young girl in Uniquely Human. By changing the setting and making it one that was more regulating and
Hmm.
trustworthy for this young woman, the speech began to come. Because one thing we have to realize that speech is one of the most fragile of human capacities. And this could be a whole other discussion that we have. But
Yeah.
in the literature outside of autism on trauma, one
Hmm.
of the
Right.
first human capacity that really is affected severely is the ability to speak if you have been traumatized in a situation. And when I say this could be a whole other discussion, is that's one of the things that has happened so much over the last few years, and that's realizing the impact of years of trauma that autistic people have experienced and how that affects the way they behave, they react to people, the way they react to a school setting, explaining a lot of what some people call challenging behavior. It's coming out of the dysregulation of the trauma, not in extreme cases, not unlike PTSD experiences.
Yeah. And I think we're at a point where that's still kind of hugely underestimated or understood or acknowledged. Maybe not so much in the professional sense. I don't know. You don't hear a lot about it, Barry. And I think it's such an important point because you talk about, again, particularly with non-speaking autistic individuals, the trauma that they must endure on literally a daily basis, of not having your needs met, not being able to communicate your wants, your needs, not being able to have a voice. The other things we talked about, stripping away autonomy, we could go on and on, right? Those things accumulate over time too. These we're not talking about just like a single. Unfortunately, they're also singular or other cases of abuse or other horrible things that also can be part of this too, right? Like in this community. So you're talking about this, but it always kind of, I don't want to say amazed, but once I learned about it, it's like, why aren't we talking about it more? Why aren't we addressing this more? Because I
Yeah.
do think it's a really big issue.
Yeah, and we are. It's beginning. When people talk about trauma-informed approaches,
Yeah.
more and more when we talk about neuroaffirming approaches, um, leaders in that area are beginning to say they need to be trauma-informed. So let me tell you a quick story.
Yeah.
A couple of summers ago, I was invited to present for a week at what's called the Cape Cod Institute, which has been going on for more than 40 years, but it's always been mental health issues, not quote unquote special ed. It almost never having presentations on autism, and I was invited after my book came out. But this was
Okay.
only 2 years ago. One of the other presenters who's been going there for years is named Bessel van der Kolk, world-renowned psychiatrist, practically defined what PTSD was, high level expert on trauma, with a best-selling book that's almost a Bible in the area of trauma called The Body Keeps the Score, how trauma is something we experience in our body, not just in our mind. And so I had the chance to chat with him. I couldn't go to his session because they had conflicted with mine, but I had a chance to chat with him, and he said to me, "Oh, Barry, I hear you're presenting on autism this week at the Institute." I said, "Yes." He said to me, "I know nothing about autism. If you read his book, the descriptions of so many people
Oh,
with
wow.
diagnosed psychiatric conditions are like oh my God, I knew an autistic kid who behaved like that. I knew an autistic woman who reacted like that. It's trauma impacts all human beings, and in
Hmm.
some cases, in very, very similar ways. And what being trauma informed is about is understanding what's impacting this person's behavior, even though it may not be a trigger in the environment, like a loud noise, like a sensory issue.
Right.
It could be something that happened years ago, and you see something that brings back that recollection. And traumatic memory is very different than our typical thought of what memory is. It's intrusive, it comes on suddenly, and it could be like a sledgehammer. That's what people who've been in war or people who've been
Yeah.
sexually abused experience. So there are many autistic adults now who say, and who are diagnosed with PTSD in addition to their autism. But one last thing I want to say about this.
Yeah.
A,
Please.
a, a lot of what we think is traumatic from a neurotypical perspective may not align exactly with what may be traumatic for an autistic person. So, walking into a noisy cafeteria may be perceived as incredibly traumatic for an autistic person. A teacher might say, "Oh, it's not that loud. I don't know what's
Hmm.
bothering him." Or he could just cover his ears and he's having a
Right.
meltdown, right?
Right. Yeah.
I've known kids who had traumatic responses to hearing the word no, because when they've been reprimanded and sometimes in the past, in some approaches, physically abused by some people, it goes along with the word no. And I've worked with kids who you could say, "Oh, look, we have an apple and we have an orange." And the child points to orange and says apple, and you go, "No, no, no." And the kid starts slamming himself in the head.
Oh my gosh. Right.
So we have to understand the triggers that,
Hmm.
as neurotypical people, we may not see as traumatic, but from the neurology of an autistic person, it very well could be. That's, I think, one of you asked about, well, where are we going in the future? What do we still
Yeah.
need to learn?
Yeah.
These are
That's,
some of the things we're learning right now. Yep.
and we're still early on. Yeah. I want to kind of wrap it up going back to
Sure.
community, because again, I think we both
Absolutely.
would agree that community is important. And we're seeing changes. We're seeing growth. When you say, Barry, I mean, what are some of the things around community that are giving you hope today?
First of all, I just want to add that, community, there are so many versions of community. Okay.
True. True.
That there's a community within your family. There's community amongst self-advocates who are on the spectrum. There's a community of people who are non-speaking and who support non-speakers. There's a community around creative activities. I'm involved with the Miracle Project Theater and Expressive Arts program and a professional company called the Spectrum Theater Ensemble, which creates its own community. It's so important to have shared values, shared vision. It's communities that change policies also,
Yeah.
not on a legal level. So the emotional support, the shared experiences are so, so valuable. And I believe it is communities that make the most positive changes for people who are neurodivergent and people with autistic diagnoses. Um, so I always say, seek out your community. Our parent retreat has become a community.
I'll bet.
And it's not the same parents who come every year. We
Right.
have parents who skip years. They say, "I miss my family." One weekend a year does that. Okay.
I believe it. Yeah, we had experience with a surf camp last year that was very similar. Again, about a dozen or so families, and like you said, it was just it was instant and like infinite community from that point on. Just sharing that type of experience together. It's really special.
It's important. It's the people who get you. It's the
Hmm.
people who could say, "I know exactly what you're talking about. You don't have to explain." The most common comment that comes out of our parent retreat each year for parents who are there for the first time, it was remarkable to be in a place where you didn't have to fully explain your story or explain your child to be fully embraced and accepted.
Yeah,
You start telling a story and you see all these people nodding their heads, you know?
that is everything.
Yes,
That is
absolutely.
everything.
So for me, I've been very fortunate to be connected both academically, both in research and on the ground and in the trenches with a few different communities. And it's what keeps me going as I approach my 75th birthday.
Well, you're going strong, Barry. We could go on and on, but unfortunately, we got to wrap it up here. But I want to thank you so much for joining me today. Again, listeners, check out Barry's podcast. It's great. It's a different style, different format, but really helpful, great information. It's uniquely human. So Barry, thanks for all that you do for our community. Thanks for being there and, being a friend and colleague now, in our fight in this world.
Yeah, absolutely. And David, thank you for the opportunity. As you said at the beginning, there's so much we could talk about.
So much. Well, we'll have to do it again. And again, I want to give a special thank you to my producer, David Yaz of Pod 617, helping bring this podcast to life, and my associate producer, Jane Pruitt, who helps edit and post episodes to YouTube every week. And to the listeners, please keep those notes coming. David.Kaufer at hey.com. And we will see you next time.